Most people think heart disease shows up suddenly, but here's the truth. Your body starts warning you 5, 10, even 15 years before your first heart attack, and traditional basic medical testing misses almost all the early warning signs. Your cholesterol, your EKG, your stress tests, they can all be normal, and you could still be developing dangerous plaque. So today, I'm going to show you how to detect heart disease before it happens using tools that most healthcare providers never talk about, but every person serious about their future health should know. I'm Dr. Kabir Harricharan Singh, and my entire approach is simple. Don't wait for disease to show up, find the earliest signals, and stop it before it starts. Although I'm a doctor, I'm not your doctor, so please check in with your healthcare provider before making any changes to your healthcare regimen, as this video is meant only to be educational and not medical advice. Before we get into early detection, we need to address why so many people feel like heart disease comes out of nowhere. Here's the main thing. Heart disease is not a sudden event. It's a slow, quiet process. Plaque builds gradually, inflammation smolders silently, and for many people, the first symptom is the heart attack itself. But that means something powerful too. The earlier you look for hidden signals, the more preventable heart disease becomes. Let's break down why traditional testing fails, and then we'll talk about the tests that can actually reveal the truth. Number 1, cholesterol panels are outdated. A basic cholesterol panel tells you about your cholesterol level, but almost nothing about whether plaque is forming. It misses LDL particle number, apolipoprotein B100, also called ApoB, and inflammatory markers. This is why two people with identical cholesterol numbers can have completely different outcomes. Your numbers may be normal, but your risk is not. Number 2, stress tests don't detect early disease. Stress tests only turn positive after a significant blockage restricts blood flow. So if your stress test is positive, the disease is already advanced. This is like finding the fire after the house is already burning. Number 3, normal doesn't mean healthy. This is one of the biggest misconceptions in all of medicine. You can have normal cholesterol, a normal EKG, normal stress test, normal blood pressure, and still have active plaque building in your arteries. That's why relying on normal labs gives people a false sense of security. So let's talk about what actually works, the tests that detect heart disease early and years ahead of standard screening. Test number 1, ApoB, the most important cholesterol marker. If you only check one marker for heart disease, it should be ApoB, because it measures the number of LDL particles circulating in your bloodstream, and those particles are what drive plaque formation. A high ApoB means plaque is forming, even if your LDL, total cholesterol, and HDL are all normal. Test number 2, lipoprotein(a), also called Lp(a), is a genetically predetermined cholesterol particle that increases the risk of heart attack and stroke, and about 25% of people have it and don't know it. If Lp(a) is high, you need a different, more aggressive prevention strategy, and catching it early changes everything. Test number 3, high sensitivity CRP, also called hsCRP. Heart disease isn't just about lipids, it's also about inflammation. hsCRP is a blood test that helps detect vascular inflammation, hidden metabolic dysfunction, and early plaque activity. It's one of the best predictors of future events, and it's extremely easy to check. Now, let's shift gears a little bit and talk about imaging that can help detect heart disease with test number 4, coronary calcium score, also called a CAC score or scan. A CAC scan is like an X-ray for your arteries that shows whether plaque has hardened into calcium. A score of 0 is actually really good, but anything above 0 means plaque has already started forming. Again, better to know early than after symptoms show up. Test number 5, coronary CT angiography, also known as coronary CTA. It's a game changer. If there's one test that can reveal heart disease years earlier, this is it. Coronary CTA allows you to see inside your arteries and measure plaque volume, detect soft plaque, which are the most dangerous kind, identify narrowing, and catch early disease long before a stress test does, because it can show a developing problem at 5% instead of discovering it at 70% when you're headed towards stents or bypass surgery. It's one of the most powerful tools in modern prevention. If this video helped you understand your heart health better, hit the like button. It helps the algorithm push this information to more people who need it. And if you want more content on metabolic health, longevity, and detecting disease before it happens, hit subscribe and turn on notifications. Your future self will thank you. Okay, stay curious, stay proactive, and I'll see you in the next video.